Hello, I'm Emma Hammett, the founder and CEO of First Aid for Life and the author of Burns, Falls and Emergency Calls, the ultimate guide for prevention and treatment of childhood accidents. I'm also in the process of writing my next book, which is similar to Burns, Falls, but it's slip, strips and fractured hips, and it's for the older population. Today, I'm going to very briefly go through when you should phone an ambulance, when it's okay to drive someone to A&E, and when it is absolutely fine to go to your GP. It's something I get asked quite a lot, and there's a few sort of fairly helpful tips that I can give you to help you make that difficult decision. Our emergency services are really struggling at the moment. It's highly unlikely you will have someone with you within 8 minutes. And so first aid training has never been more important, or first aid skills have never been more important. So what you are doing in those first few minutes whilst you're waiting for an ambulance are critically important. And I'll run another Facebook Live on that, on exactly what is sensible to be doing whilst you're waiting for help. Okay, so the key thing is, if you've got someone who doesn't appear to be breathing, clearly they're going to need an ambulance. You are also going to need to give them first aid as well. So if they're unconscious and not breathing, you're giving them CPR. If they are having chest pain, difficulty breathing, they are feeling weak or numb or struggling to speak, have something like a weakness down one side, clearly those last ones, they could be having a stroke. The quicker you get someone to hospital, the quicker they're treated. If it's a stroke caused by a clot, if they can get a clot busting drug in quickly, they can actually reverse an awful lot of, they've got the possibility of reversing an awful lot of the after effects of a stroke. So you can actually reverse the damage that's being done. So for a stroke, the quicker you can get them, you can get an ambulance and get help, the better for them. And likewise for chest pain as well. If you suspect they may be having a heart attack, or even if they're having a very severe angina attack, if you can get an ambulance and get them to hospital, there are an awful lot of things that the paramedics can do as well on the way to hospital, and they will also take them straight to a specialist coronary care centre. So ambulance please for those. If they are experiencing very severe bleeding, which you're unable to stop by applying direct pressure to a wound, then clearly they need an ambulance. If they're struggling to breathe and they're breathing in a strange way, maybe the bottom of their chest is sucking in below their rib cage and they're using all their accessory muscles, then they are seriously having laboured breathing and they need help fast. They need a paramedic on site. The key thing is that if you pop them in the car and drive them to hospital because you think, oh, I'm just round the corner and that's going to be quicker. If they deteriorate in the back of your car, it's going to be far more difficult to treat them than if you had waited where you were and the paramedics had arrived. So it's about thinking, could that person get worse? Is it life-threatening? And could that person get seriously worse whilst I'm on the way to hospital? That's the difference between getting an ambulance and driving them to hospital. If they're not going to deteriorate dramatically and it's not life-threatening and it just seems sensible to get an ambulance, then you're probably using the ambulance as transport, and you could go in a taxi. So the key thing is it life-threatening and could they be getting worse fast? Okay, so we've gone through. They're not breathing, they have chest pain, if they're showing signs and symptoms of a stroke, if they've got severe bleeding which you can't stop by applying direct pressure, they're struggling to breathe or breathing in a strange way, if they're unconscious or unaware of what's going on around them, if they've had a fit for the first time, get an ambulance. You don't know what's happening. It's much more sensible to get them seen and assessed and transported to hospital in a nice supervised manner. If they're having a severe allergic reaction, they've got difficulty breathing, they may collapse, get an ambulance to come to you. If they get worse on the way, it's serious. So get an ambulance to you and tell them how serious it is. If a child is burnt and the burn is bad enough to need dressing, personally I would get an ambulance. A lot of people will say, cool running water for at least 10 minutes and you can apply a dressing and get them there. I would get an ambulance for a child or someone who's elderly, who's severely burnt. Get the paramedics to come to you and keep cooling the burn whilst they're on the way. Keep the casualty warm and calm and get the emergency services on the way. If someone's fallen from a height, they've been hit by something moving at speed, or they've been hit by force and there's a possibility of a spinal injury, keep them still. If they're conscious, you're going to keep them still where they are, get an ambulance to come with you, come to you. If they're unconscious and you're worried about a spinal injury and you're worried about their breathing and their airway, you may need to very carefully roll them into the recovery position, keeping their spine in line. Right, you don't get to A&E, you don't get seen any faster if you arrive in A&E in an ambulance. So they will still triage you in the same way when you arrive, whether you arrive by car, by taxi or by ambulance. And they will make the decision as to how quickly you need to be seen. So it isn't a fast track, it isn't a backdoor way of getting in. It's not how it works. So please only use ambulances if you really need them. And if you do really need them, then absolutely use them. If you have someone who's got a fever and they're floppy and lethargic, or they've got, it's not quite right, but they're still with it, you can drive them to A&E and get them seen there if you're unable to get to your GP or your walk-in centre. If they've got severe abdominal pain, but they seem quite with it, obviously there's degrees of this. If there's severe abdominal pain and you think that maybe it's not their abdomen and it could be a heart attack, or if you think it's that severe that they're showing signs of shock, then that puts them into an ambulance side. But if they've got severe abdominal pain and they're not looking horrendous with it, then you can drive them to A&E to have them checked out. Again, if they've got severe abdominal pain and they're pregnant, then again you might need an ambulance. So make a judgment call on that one. If there's a cut that is gaping or losing quite a lot of blood, if they've amputated a finger or if there's something embedded in a wound, you do need to get to hospital, but they're not going to die of life-threatening blood loss on the way there. So if you're able to control the bleeding and get them there in a safe and calm manner, then drive them to hospital yourself or go in a taxi. If you still feel you need an ambulance, then by all means get an ambulance. But I'm just saying that in those particular situations, you don't necessarily need an ambulance. If they have a leg or an arm injury and they can't use the limb, if you're able to transport them yourself safely without making anything worse, then get them there yourself. If they've swallowed poison or you suspect they've swallowed poison or tablets and they seem okay, then you can phone 111 or you can phone the Poisons Direct database direct, and you can contact them and get their advice as to how serious it is. If they've swallowed poison or a corrosive substance and they are seriously ill with it, then you need an ambulance because you don't want them to deteriorate on the way to hospital. So again, it's whether they're, what they're like and whether they're able to talk to you and explain what's happened and whether there's a danger of them deteriorating fast. You can go to your family doctor with less serious, non-life-threatening medical concerns. You can also go and visit the pharmacist. There's an awful lot of people that end up in A&E with common colds, minor injuries, and things that actually your pharmacist or your local doctor can help you with. And minor injury centres, if you have one in the area, they are a better place to go to with minor injuries than A&E. I do hope that's been useful. That's Emma Hammett from First Aid for Life and onlinefirstaid.com. Many thanks.